discuss about different abnormalities of ECG.
This is the diagram showing conducting system of the heart. This is SA node, this is AV node, then bundle of His and Purkinje fibers. SA node is a pacemaker of the heart. When impulses are generated by an ectopic focus somewhere within the atrial myocardium rather than SA node, there will be atrial tachycardia, which is rapid and regular contraction greater than 100 beats per minute. In this case, P wave may be abnormal in shape. Now, atrial flutter. It is a rapid and regular contraction at a rate of around 250 to 350 beats per minute. All the impulses from the atria cannot be transmitted to the ventricle due to varying degree of AV block. Majority of the atrial impulse reaching to the AV node are blocked, and impulse which occurs during the non-refractory period of the ventricle can be conducted from the atria to the ventricle. This causes irregular ventricular rhythm. In ECG, atrial rate found 250 to 350 per minute. Ventricular rate are less than the atrial rate. P wave are replaced by flutter waves that gives a sawtooth appearance, and a varying degree of AV block will be found. Now, atrial fibrillation. When rate of contraction of the atria becomes more than 350 per minute, it will cause a twitch-like contraction of the atrium rather than active atrial contraction, which is responsible for ventricular filling. In ECG, atrial rate will be more than 350 beats per minute. P waves will be replaced by the fibrillation waves. There will be normal QRS complex, but ventricular rhythm will be irregular. Now, ventricular premature beats. Ventricular premature beat occurs due to premature discharge of the ectopic focus in the ventricle. This will cause ventricular contraction. Atrial contraction will not be affected as impulses originated in the ventricle. In ECG, P wave will be absent, QRS complex will be wide, bizarre and tall, T wave will be in the opposite direction, and there will be compensatory pause. Now, ventricular flutter. It is a rapid, regular ectopic ventricular discharge at about 150 to 300 per minute with an abnormal intraventricular conduction. It results in wide, bizarre QRS complex fused with the T wave. Then ventricular fibrillation. It is a disorganized activity of the heart which result in irregular deformed deflection of varying height, width and shape. There will be twitch-like contraction of the ventricles, so effective output of the blood will not be there, so it is a fatal condition. Now, sinoatrial block. In this, there will be blockage of impulse transmission from SA node. So, no impulse will be transmitted to the conducting system. It will result in complete dropout of the cardiac cycle. If sinoatrial block disappear, then impulse generated in the SA node will be able to travel through rest of the conducting system and normal cardiac rhythm will appear. If there is a persistent sinoatrial block, in that case pacemaker activity will be done by the other part of the conducting system. In ECG, there will be a dropped beat. You can see there is no cardiac cycle. Now, atrioventricular block. In AV block, there is a disturbance in the conduction of impulse from the atria to the ventricle. There are different types. First degree atrioventricular block. In that, it is an incomplete block and there is a delay in the conduction of impulse from the atria to the ventricle. In first degree heart block, there is gradual lengthening of the PR interval, but each P wave is followed by QRS complex. In second degree heart block, there will be gradual lengthening of the PR interval followed by a missed beat. So, ratio of conduction of impulse from atria to ventricle will be 2:1 or 3:1. Now, third degree heart block. In third degree heart block, there is a complete interruption of impulse transmission from the atria to the ventricle. No impulse can be transmitted from the atria to the ventricle. So now ventricle will start behaving like a pacemaker and generate its own rhythm. In ECG, there is no relationship between P wave and QRS complex. QRS complex will be independent and P wave will be recorded independently.